is Irene, and I am a registered physical therapist in Canada and in Hong Kong. And I just finished my PhD study in the Hong Kong Polytechnic University, Department of Rehabilitation Sciences. And in the past 6 years, I've been my pleasure to work with a lot of people with Parkinson's, and that they are really helpful. And today I'm going to share with you my study and hope you will enjoy it. The topic I'm going to present is a multi-system balance training program enhances balance, gait, and four-point functional performance in people with Parkinson's, and it's based on the evidence-based physical therapy. And that's the content for today. I'll talk about briefly about the balance and force in Parkinson, and how balance training and fall prevention can improve their functions. And also I'll go into detail about my balance training program for people with Parkinson. And importantly, at the end, I'll talk about how all of you can get started and how to stay active. As all of we know, Parkinson's disease is the second most common progressive degenerative disease, and it affects about 100,000 people in Canada and about 13,000 in BC. And among all of them, there's about 2 to 10% with young onset. However, the mean age of onset is about, after mid-age, is about 60 to 65 years old. And there's a high risk in older people because of the small changes in their brain. And as far as we know, still the cause of Parkinson's is still unknown. But most of us believe that is the interaction of the genetic risk factor as well as the environmental and lifestyle risk factor. And interestingly, study has shown that by doing physical activities of about 115 minutes per week, there's a decreased risk of about 40 to 45% after doing the exercise. And also the clinical manifestation are the resting tremor, bradykinesia, rigidity, postural instability, and together with some of the non-motor symptoms such as hallucination or others will lead to falls and injury. That's why we do think that that's a large negative impact and burden on individuals with PD, families, and caregivers. Let's take a look at the consequence of falls in Parkinson's. Fall is common, especially at the later stage, and physically it can cause fractures and intracranial hemorrhage, and also it has negative psychological impacts such as fear of falling. So that's why all these impacts will lead to immobilities, functional declines, decrease in quality of life, as well as early admission to the nursing home. We all know that medicine is the first-line treatment to treat the motor symptom. But in fact, the study has shown that levodopa or dopamine agonists, both of them, they're not very useful in treating balance and force in PD. And how about surgery? And usually surgery are done at a more later stage, and also it seems not very effective to prevent force and improve balance. And lately, evidence has shown that exercise can really improve balance and force in PD. So we'll look more into that in the later part of the talk. So in terms of physical benefits, what are the benefits in doing exercise for the people of Parkinson's? First of all, it will improve their skills and prevent falls. and also can maintain or improve their flexibility, strength, and endurance. And also it can enhance independency and confidence in daily function and leisure activity. More importantly, recent finding has shown that there's a slowing down of the progression of disease during exercise because the antioxidant enzyme increased, and also there's a decrease in dopaminergic cell loss. And also exercise can help to synthesize more useful neurotransmitter as well as neurotrophic factors. So really helps to prevent cell loss and then slow down the progression at the same time. Conventionally, we physiotherapists usually train doing balance training. We're using a lot of walking training, using different balance exercise, cueing, and movement strategy exercise, as well as treadmill. But lately, there's more evidence showing that other exercises such as Tai Chi, dancing, boxing, Nordic walking, and virtual reality also could help the people with Parkinson to really boost up their balance performance and gait performance. So let me talk a bit more about the balance disorder and force in Parkinson's. This is a simple diagram indicating that for our postural control, there is really a complex interactions between our musculoskeletal system and nervous system. So it's not just like our own take the whole control, but it really depends on what tasks we are doing and which environment we are in. And also there's in fact not just one the dopaminergic system in our body which will the disorder of it will cause Parkinson. In fact, is the dopamine the dopaminergic system itself would facilitate appropriate while inhibiting the competing motor response. So a disorder of the system will lead to bradykinesia, rigidity, and as well as resting tremor. But on the other hand, there are two more systems. One is the cholinergic system, and the other one is the noradrenergic system. And in fact, these two systems are more responsible for postural and gait control and our cognitive function. So with problem in these two systems will lead to postural instability, gait disorder, and fall at the same time. And I also would like to introduce to you there's a theory put forward by Professor Horek in the Oregon Science University. It's about the different impaired domain of the balance domain among us. So the first one is the biomechanical constraint, which means our flexibility and strength. The second one is the limit of stability, which means the reaching and kneeling movement. The third one is the anticipatory postural adjustment, indicating the preparatory work and also the dynamic stability prior to and during our movement. The fourth one is postural response and representing the compensatory stepping when we have to counter external push or pull. And the fifth one is the integration of sensation, which means that the integration of our body position, sensory, and visual information. And the last one is the dynamic control of gait. It is important, especially in outdoor environment, because we need to walk in different speed. We have to add a secondary task, as well as we have to really interact with our environment when we are walking. So what are the abnormalities of postural control in Parkinson's people? First of all, in the domain of biomechanical constraints, we all know that usually they do have an abnormal posture, And also they have a decrease in the trunk and lower limb muscle strength. So therefore, there's also a decrease. They find it's very difficult for them to stand up. They need like a field trial before they can do that. And in the domain of the limit of stability, people ability to hold an inclined posture is decreased, especially they're leaning forward or leaning sideways. So when they overdo it, it will probably will cause falls. And in the domain of anticipatory postural adjustment, people find it's hard to weight shift, and especially when they are doing the walking, when they start to walk, we sometimes really hard for them to lift up their feet. And at the same time, there's a poor transition from a large to a small base of support. So when they're doing a single leg standing, when they are doing sitting up from a chair, when they're on their feet, that's a problem. And also, it's a shortened step length as well as inconsistent footstep. So this will also lead to falls too. In the domain of postural response, there's a decrease in stepping reaction in all different directions, though people are prone to fall forward, sideways, or backwards in all directions. And in the domain of sensory integration, that's impair of proprioceptive information processing. So it's difficult for them to maintain postural stability when the eyes are closed or when they're standing on different terrains. And lastly, in the domain of dynamic control of gait, there's a slower gait velocity, and there's decrease in push-off at the ankle and a lack of foot clearance. And at the same time, there's difficulty in turning, walking due tasks. That means when a second task is added, and also doing complex outdoor activity. So there will be a further decrease in gait speed and freezing, and all these also will lead to falls. How about falls in Parkinson? It's very common, right? All of you know. And a study has shown that there's a high fall rate of about 35 to 70%. And even recurrent fall rate is high, it's about 25 to 50%. And interestingly, it's found that the most common fall-related activities walking and turning is about 45%, followed by transfer standing, and it's about 20 to 30%. So there's some implication of this, and we'll talk about it later, and how it affects our plan for rehabilitation. And regarding the injury, there are about 30% of falls will result in injury, and about 3% will cause serious injury, which require medical attention. And in an Australian study, in a long-term follow-up of 20 years, and it was found that it's about 1/3 of people after fall, they have fracture. So it's really, really a big problem that we have to deal with. And also, we don't really have local figures, but it was found that there are high costs for hip fracture care. It's about US dollar 192 million dollars per year, and also it was found that for residential care is also 5 times more than the home care. So it's really important to prevent falls, especially injuries in people with Parkinson's. And how about we know that the falls are very serious. So what are the risk factors for falls? In fact, interestingly, it was shown that the strongest fall predictor of a fall is in fact the previous fall in last year. So that's why early prevention is really, really important. So once you fall, which means you have a big chance to fall again. So, but how could what could we do in order to reduce our risk factors? In fact, you can see that such abnormal posture, muscle weakness, balance impairment, slower walking speed, and deficit and due task walking, and with a lower balance confidence, they are all modifiable, risk factor that we really can work on it. So really, we have to start to make a change as early as possible. And why early balance rehabilitation is so important? Because a study has shown that people with Parkinson's do have balance impairment at earlier stage, and physical exercise is effective in improving their balance, gait, muscle strength, motor symptoms as well, and both long and short terms. And those exercise for people with early PD, they're not just cost effective in delaying mobility deterioration, especially they are cost effective in preventing falls. So when's the best time to start exercise? We do think that as all of you know, the whole and yang staging. So we do think that the exercise should start as early as possible, maybe immediately after diagnosis at stage 1. So even if you have only very mild symptoms on just one side of the body, even if you don't have any balance impairment, you have to start your exercise right away in order to decrease the disability and increasing the independency. And let me show you some more evidence on the effectiveness of balance training and fall prevention. And this is a Cochrane review in BMJ, the British Medical Journal, in year 2012. And it's about, I think they sum up about like 20-something study regarding the physical intervention in Parkinson's disease. And it was shown that physiotherapy has short-term and benefits in Parkinson's disease and balance and gait performance and also motor functions. And how about long-term effect of exercise? And this is our recent study, and in this year in the New Rehabilitation and New Repair Journal is on effects of exercise on falls, balance, and gait ability in Parkinson's disease. And we found that there's a positive effect of exercise training on enhancing balance and gait performance and in reducing fall rates. So it's a good news in both long and short term up to 12 months. So we really have to work hard on it. So there's a summary of the result of exercise, effect of exercise. And first of all, it has long and short-term benefits on balance, gait, and motor performance, as well as fall reduction. And also there's a long-term benefit on quality of life. And there's also shown a long-term benefit on fall reduction. And moreover, by analyzing the detail of the exercise protocol itself, we found that doing more complex balance training that is addressing more domains will lead to a greater improvement in short-term balance skills. So that means like we really do not just stick to one kind of skill. We really have to learn new skill, learn multiple skill in order to enhance our balance. However, there's it's still not known that whether exercise could reduce fall risk or induce fall, and what's the benefit of it on due task, gait, and fall prone activities. So this is like a summary of what kind of exercise can improve balance and preventing falls. First of all, we think that it's a highly challenging physical therapy and balance exercise by moving our center of mass more, by narrowing our base of support and using less upper limb to support ourselves, and working comprehensively on the balance training would help to improve balance and preventing falls. And regarding the intensity, and we do think that people has to practice at least 2 to 3 hours per week for 8 weeks continuously. And in fact, it's not just for 8 weeks. We should after learning, this is 8 weeks is to to optimize this balance skills, but for the ongoing effect that you should continue to practice it for a longer period of time. And there are 3 studies which has studied the effect on preventing falls. those are the Tai Chi, the assisted balance and gait training, as well as the progressive resistant exercise or movement strategy training. And if I have more time at the end, I'll go through them one by one. So let's talk about my study. In fact, it's a novel study involving a multi-system balance control training, including all the domains. And it's a group training program supervised by physical therapists. And we really adopt a task-specific and context-specific approach. That means we don't just do it in a lab-based or in indoor. We do it outdoor. We also do outdoor training. And the objective is to improve the balance and gait, and also improve the balance and 4-point functions, as well as in order to want to decrease the falls and injuries fall among the people with Parkinson. Because previously there was no study targeting in PD non-fallers and single faller at earlier stage. In fact, they do have higher fall risk than normal people. And most of the study, the balance training are only conducted at a lab-based and indoor setting. And most of them also did not put the full challenge on all the balance domain. But we do think that targeting more domain and doing more complex activity could be more effective in enhancing their balance performance. And also we would like to investigate the effectiveness of exercise on injuries fall. And this is the study design. We have recruited 84 people. This is a assessor blinded randomized control trial into 2 groups. And for the experimental group, they undergo like 4 weeks of indoor training, followed by 4 weeks of outdoor training. And for the control group, they have 8 weeks of upper limb training in sitting. And the physical therapist is a trainer. They undergone like 20 hours per sessions per week for 8 weeks. And there's a few job hours. And we follow them at 6 months, and also for as per training, after 6 months after training and 12 months afterwards. And also we give them a DVD to practice 3 hours per week for 6 months. And those are the inclusion and exclusion criteria, and you can see that we recruit the people with mild to moderate stage, and they're also able to walk independently outdoor for a certain distance. And the exclusion criteria, if they have other disorder and they have a low MMSE score, or they have a receiving other structure program. And this is the primary outcome. We use the balance evaluation system test total score, and to measure all the 6 PD-specific domain for balance performance, and a higher percentage in the score implying that there's a better balance performance. And the secondary outcome include the gait outcome. We measure the gait speed, and we also measure a time up and go test, which means we ask people to stand up from the chair, walk for 3 meters, turn around, and then go back, and then sit down in the chair again. And also, as this usually the normal time is about 8 to 9 seconds. And but additionally, we really want to challenge them cognitively. So in addition to the timer and go task, we ask them to do some subtraction tasks at the same time. So we found that in normal people they usually just take about 10% more time, but in people with Parkinson, they may take up to another 30 to 60% more of time when doing tasks. And regarding the 4-point functional performance, there are 3 of them. So measuring how far they can reach forward, how much time they do 5 times to standing, and how much time they can stand at their own leg and on their own leg. And usually if they can do it for about 20 seconds, that means it's really good. But if they can only stand for 10 seconds or less, and that might indicate a fall risk. And regarding the fall-related outcome, we measure the fall rate, and as well as the injuries fall risk and rate at the same time. And this is the experimental protocol. So, so we're really working on different domain, and we work on the postural and the postural part, and also the flexibility part. And also we do a functional task and enhance their mechanical constraint. And we use modified Wing Chun. In fact, it's a Chinese martial arts, and that was practiced by Bruce Lee. And it's really, unlike Tai Chi, is emphasized on more rapid movement, as well as more the upper arm response. So this is, and also we do like a perturbation. The therapist can perturbate the subject so that they will enhance their compensation stepping response. And also we design our own balance dance with music, and also square stepping exercise. This is for the square stepping exercise is originated in Japan. They're stepping on the mat with square on it, so they are practicing the different patterns of stepping in multi-direction. And also we develop our balance dance to enhance the reaching and the dynamic postural control of gait. So by progressing, by improving the amplitude, increasing the speed, increase the number of repetition and sets, and progress from simple to more complex action, all the domains are being practiced. And regarding the outdoor protocol, we use the facility in the park, and also we practice balance dance and Wing Chun outdoor in different terrain. As well as we ask them to step over obstacles and working on some grassland. And at the same time, we do walking up and down stairs and walking on the slope. So that will also challenge all their impaired domain. And how about so if the weather is not good, then also we can take them to the outside the mall, because they already learned their strategy, the basic strategy, right? And now they are going to use those strategy to practice a more high level of function, which means those 4-point activity and dual task walking. So we use we walking in the mall with more people. So to in order to make them to do a dual task walking, and also they are doing the walking the supermarket, talking on the phone and checking the price. And also we use the elevator, escalator, as well as the narrow passage to challenge different aspects of the impaired domain. And after that, they continue for 6 months. And this is the control. This is the control protocol, and they are the subject all do the exercise in sitting, with upper limb exercise and hand dexterity involving no balance at all. So this is the result, and this is the comparison of the two groups. And in fact, there's no basic difference between the two groups, and both of them had very good attendance, because even the control group is a placebo, although it's a placebo, but people with Parkinson, they also have upper limb problem. So that's why they're also very eager to attend. And for the 6-month exercise compliance and follow-up, seems to be there's a higher percentage of people who complete the suggest protocol in the experimental group as compared to the control group. But basically, there's no significant difference between the two. And this is the result on the outcome measure. So we're excited to tell you that in both long and short term, there's a greater improvement in the experimental group in the changes of best total score from baseline, indicated at all endpoints. And regarding the secondary outcome measures, for the majority of the gaits for the gait performance, there's a significant improvement at post 8 as right after training, as well as 6-month follow-up. And regarding the 4-point functional performance, there's very good improvement in all the outcomes, including the functional reach, 5 times sit to stand, as well as 1 leg standing. And regarding the fall risk and fall rates, there's no fall or injuries fall during the training. And more interestingly, we found that there's a decrease in injuries fall risk, as well as there's less healthcare service needed. And it seems that the experimental subject have used their upper limb more for landing, probably due to the practice of Wing Chun. So in our exercise, we found that all the exercise we have decided could enhance as task specific, and they could enhance their performance in all the 6 domains. And the progressive challenge from basic indoor exercise to more complex outdoor activities would help too. And particularly for the outdoor training part, we encourage the participant to practice the exercise in their daily environment every day, so they are more get used to the environment and have a better ability to cope with the changes around. And also by the positive feedback from the trainer, we do think that there's do help to have a good improvement during short term. And also based on the gait and functions, all the exercise will improve the muscle strength, step length and velocity, as well as the dual-task gait ability. And in fact, the indication of a decrease of the dual-task time up and go is very important, because it means that the subject need less attention to perform walking while a subtraction task is needed. That means they have a better single and dual-task performance and post 8 weeks. And they also, at the same time, they also have a better balance control over when they are doing the 4-point tasks, such as reaching, leaning, sit to standing, and standing on 1 leg. That means probably their 4-point functional performance and fall risk will be decreased. And in the long term, they have since all the intervention are goal directed at targeting and on the domains, and they use the DVD to practice, and therefore they are very good skill retention, and that's also can use a free of charge venue for practice. So I think all this will need to help them to develop a very, very good exercise habit and behavior. And so that's why they have that's a positive carryover effect in balance, dual-task gait, and 4-point functional performance up to 12 months. So which is very promising. And in addition, our study is the first one to report the reduction of injuries failure among non-fallers and single faller after a multi-system balance training program. And the subjects has improved balance and 4-point functional performance both as indoor and outdoors, and they could use upper limb more in landing, possibly due to a practice of arm response with Wing Chun. And the descent movement with outstretched arm probably will help them to absorb some of the energy, so that will be less impact when they fall onto the ground to overflow to other part of the body. And there's a better postural response and protective arm reactions during fall. That's why they have a reduction of injuries fall risk. And regarding the clinical implication, this is the first study using a multi-system balance training program for people with PD. We do think it's feasible and safe for improving postural stability, improved dual-task gait and functions, as well as decreasing injuries and fall risk in the long term. And the more an outdoor activity, it's easily accessible and it's really useful for training. However, our result cannot be generalized to recurrent fallers or people in the advanced stage. And And more demanding and high-risk outdoor tasks are not really feasible because we really concerned about their safety, because some of them can be rather impulsive. Although we really do have like enough people to supervise. For example, we go outdoor, we at least have like in the ratio of at least one therapist to 2 or 3 subjects, but still safety is our main concern. And since our protocol is developed in local context in Hong Kong, so outdoor training here may be limited by weather. But there's still like a lot of things we can do. So in a conclusion is that the multi-system training program enhances comprehensive balanced performance in people with BD over short and long term. And this program also enhances gait and functional performance in people with BD over short and long term. And we also see this promising effect shown in the reduction of the injuries fallout in the experimental group. So how to get started? Yeah, this is a very important point I would like to raise at the end of my presentation. First of all, if you have a risk of heart disease, or you have been inactive for a while, or if you're older than 70 years, and you better to consult your doctor before starting. And also try to exercise when you feel best, or if the medication is working well. And then locally, you can also consider to join some special exercise class for Parkinson's, which you would enjoy. So have fun, really have a lot of fun with it. So classes like such as Tai Chi, dance, and Parkinson wellness recovery here. I think they're all very useful for Parkinson's people at different stage. And importantly, you should find a partner or to work in group that will enhance your adherence. And also, but beware of that if you have cardio signs such as breathlessness, nausea, chest tightness, or unusual pain during exercise, and you should inform your instructor immediately. And you might need to go to see a doctor if this condition persists. And how about to keep going, to stay active? So you should start from today, you should decrease your sitting time. You should walk more. So it's nice weather outside in Vancouver. You should walk more. You should practice more outdoor walking every day. So the protocol is about you should exercise at least 3 to 5 times weekly, 30 minutes per day. So it should be about 150 to 180 minutes per week. And you should start with a gradual warm-up and do some balance or strengthening exercise, because balance, as I say, is more like it's a broad spectrum including strength. So you should practice balance, endurance, and finally finish with cool down. And also exercise with large movement. So if you are doing brisk walking, you should walk with your arms swinging with the large swing and also a large step. But just be careful when you're doing the it's different from endurance exercise. You can really, like doing cycling, you're doing walking, you can do it fast and then with large movement. But when you are practicing the balance skill, just be careful. Just start gradually. But you do, I really suggest you to try a variety of balance skill in different domain. And if you can manage it well, then practice it with do tasks, either multitask or cognitive tasks while you're walking. And more importantly, you should do some more outdoor exercise, and preferably under guidance with exercise professionals specialized in working with Parkinson's. So this is a summary of what are the components, what are the exercises that we could do for balance training and fall reduction. So in the domain of biomechanical constraint, you can do some stretching, lower limb strengthening in the gym or with weights or sandbag. And in order to enhance your performance in limb of stability, you should do a more reaching forward, sideways, reaching. And actually, the anticipatory postural adjustment is the key. Like even every balance exercise would involve this domain, and you can do linear stepping, lunges, sit to standing, one leg standing, heel and toe stand. And for the postural response, actually, we therapists, we sometimes we work people on treadmill. We will start in treadmill to encourage them to do a stepping when they start or stop, and ask people to walk on movable high walkways, and also do some pushing or pulling while they are standing or walking. And regarding the sensory orientation, we suggest people to walk on soft surface or outdoor surface with different terrain. And finally, it's a good idea if your basic skill has been established, it's better for you to go one step further to try to walk in different direction, different speed, practice do task walking, and also maybe do some obstacle path if you can. So this is the take-home message. So all of you really have to start exercise in early stage. Optimize your self-care management with your medicine, with your diet, with your exercise, and really have to develop a good exercise habit. And if you do have some question, like if you have difficulty like exercising regularly, if you have question on exercise type, intensity, frequency, and safety, or if you have problem of movement slowness, posture, balance, walking and freezing and falls, and you better to consult your physical therapist around you, and they sure can help. And finally, and if you go to the App Store, you can always type the Parkinson and look for some useful mobile apps for exercise learning and learn more about Parkinson. There's not much in the market now, but hope we can like we as rehab scientists can work with those IT people to hopefully to develop more useful app to help you to exercise and enhance your exercise habit. And this is my end of my talk today, and thank you very much for